Take you live to Calgary. The Premier there is speaking about that E. coli outbreak at daycares and a final report being released here on food safety.
But while the situation didn't end in deaths, we do recognize the devastating impact it had on those who were affected by it. The children who got sick and their family members who suffered the pain and anxiety of watching their loved ones fight for their lives. Some impacts are still being felt today, almost a year later. When parents put their children in daycare, they do so trusting that their kids will be cared for and kept safe. And that's because we have systems in place to regulate and monitor health and safety practices in licensed facilities. We know this outbreak has shaken that trust. And as policymakers, we must do whatever we can to ensure this doesn't happen again. During the crisis, our top priorities were looking after the people who got sick and tracking and containing the source of the outbreak. But we also recognized that we needed a clearer understanding of how it happened. That's why, as the crisis was unfolding last September, I called for the creation of a review panel to get to the bottom of what caused the outbreak and to ensure the policies are in place to hold operators accountable and to prevent it from happening again. The review panel, led by former Calgary Police Chief Rick Hansen, was made up of childcare operators, a food service operator, and subject matter experts, including a pediatrician who treated some of the children. Their task was to conduct a comprehensive review of the government policies and food safety practices that keep our children safe. The review panel carefully considered every angle of this issue over 7 months. Their work included a thorough review of the relevant legislation, regulations, and inspection processes, as well as an engagement with people involved in the outbreak. The review panel produced a report with 12 primary recommendations and 27 sub-recommendations for strengthening food safety in Alberta's licensed childcare facilities and the kitchens that serve them. These recommendations include promoting a culture of food safety, making improvements to legislation and inspection systems for food safety, and establishing new major investigations protocols with consequences for operators who've been found to have repeat violations, and supporting better system alignment and integration in our food safety system. I do have to thank the panel members for their work and their dedication to this critical task. It's exactly the kind of thorough, solutions-oriented analysis I expected when appointing a 40-year law enforcement veteran to chair the review panel. Since receiving the report, our government has been studying its recommendations carefully. We will be acting on some of the recommendations immediately. Some will require us to change existing laws and regulations, and others will require more considerations so we fully understand how they'll impact childcare operators, food service operators, and families. But let me be clear, it's our government's intention to act on every recommendation we can to protect the children's safety and to restore trust in the system. Thanks to the members of the review panel, what we have here is a detailed roadmap for improving food safety in Alberta, and those improvements to policies are exactly what we'll deliver. Now I'd like to invite Minister Adriana LaGrange to share more.
Thank you, Premier, and good afternoon, everyone. Thank you for joining me in Calgary today for this important update on the work our government is doing to improve food safety and better protect children in licensed childcare facilities across Alberta. Last fall, Calgary experienced an unprecedented E. coli outbreak across multiple licensed childcare facilities in the community. For many families, this was an extraordinarily difficult period, marked by weeks of uncertainty and fear and distress as parents face the unimaginable challenge of watching their children struggle with serious infection. And I had a chance to talk to some of those parents, and it was heartbreaking to watch what they had to go through. The outbreak lasted 51 days, affecting 17 licensed childcare facilities. This resulted in a total of 448 cases of E. coli linked to the outbreak, with 39 individuals, including 38 children, being admitted to hospital. This crisis underscored the critical importance of food safety. Acting swiftly, Premier Smith tasked Minister Jones and myself with finding solutions to prevent a crisis of this magnitude from happening again. We acted quickly and established the Food Safety and Licensed Facility-Based Child Care Review Panel, comprised of experts with knowledge of licensed facility-based childcare, food service establishments, and best practices in food safety, public health, and clinical management of E. coli in children. Their mandate was to thoroughly examine all the details and circumstances surrounding the outbreak and propose recommendations to strengthen legislation and improve inspection processes governing food safety in licensed childcare facilities and the kitchens that serve them. The review panel the review panel has deliberated and analyzed all relevant legislation, regulations, standards, and guidelines, including the Public Health Act, Food Regulation, Institutions Regulation, and the Early Learning and Child Care Act and Regulation. This past spring, the review panel shifted focus and held a series of engagement activities to gather additional insights from affected families, affected childcare providers, subject matter experts, organizations and associations, and the general public. This collaborative approach ensured that the recommendations would be both practical and effective. Through these sessions, we learned that parents and operators want children to be in an environment where food handling practices are consistently followed, and parents also stressed the importance of reestablishing trust within the food safety system. I am pleased to announce that the review panel has completed its assessment. After 7 months of thorough work and stakeholder engagement, they have proposed 12 primary recommendations and 27 sub-recommendations. These recommendations focus on 3 key themes. Fostering a culture of food safety that supports high-quality, safe, and healthy learning environments for children. Enhancing public policy, legislation, and inspection systems for food safety. And improving system alignment and integration. So these themes are crucial for guiding the recommendations under consideration and in shaping a food system, safety system that is trustworthy, accountable, and centered on the needs of families and their children. So work will begin immediately to implement several recommendations, including establishing clear expectations and frameworks for public health inspections. Work has already begun to increase the frequency of public health inspections and to improve response times in childcare facilities with food safety concerns. Planning is underway to implement the recommendation to raise awareness of reporting mechanisms for parents and staff, enabling them to report food safety concerns and unsafe handling, as well as working within, unsafe handling practices within licensed childcare facilities and food establishments serving these facilities. So this will also include the option for anonymous reporting, and we know how important that is. Additionally, planning is underway to require all licensed childcare providers to prominently display their most recent public health inspection reports in a place where parents and guardians can easily see them when dropping off or picking up their children. So these recommendations are thorough and provide us a roadmap by which we can start to make changes that will improve food safety and better protect young Albertans in childcare facilities. It's important we get this work right and are thoughtful in how we implement these important recommendations so that we can protect the health and well-being of children now and into the future.